prepare to remove the chest plate. For orientation, we review the skin incisions that we made previously. We first have incised laterally from the jugular notch along the clavicle to the acromion and along the anterior axillary line. We've also made an incision in the midline along the sternum and along the costal margin 2 finger breadths above the costal margin. We now reflect the skin here to the posterior axillary line, and we reflect the superficial fascia, which includes the breast, as well as the deep fascia. We reflect also the pectoralis major and pectoralis minor muscle, and which now reveals the ribs and the intercostal spaces. We have made our saw cut across the superior aspect of the manubrium, carried it across the first rib and the second rib, and then down to the posterior axillary line, avoiding the axillary vessels and the brachial plexus. Along posterior axillary line, we followed our saw cut down to 2 finger breadths above the costal margin, and then we've continued our incision along the costal margin, but 2 finger breadths superior to where we've cut the sternum just superior to the xiphoid process, and we've made the same cuts on the opposite side. It may be useful for you to use the oscillating saw and the scalpel, as well as the scissors, to complete this dissection. You may also find it useful to abduct the shoulder. We now have an inferior view of the chest wall. For orientation, we show the jugular notch and the sternal angle. We now elevate the chest plate, which remains attached at the manubrium, and we can see the deep surface of the anterior chest wall covered with costal parietal pleura. We can see the right pleural cavity with the right lung, the left pleural cavity with the left lung, and we can see pericardial fat surrounding the heart. We will now cut the remaining attachment of the chest plate so as to free it up completely. We now have a view of the interior part of the chest wall. For orientation, we show the manubrium here where we've made one of our cuts. We show the sternum in the midline, and we show our inferior cut just above the xiphoid process. We can see the interior of the ribs and the intercostal muscles covered by costal parietal pleura. Just lateral to the sternum, we've removed a small portion of costal parietal pleura to show the internal mammary or internal thoracic artery passing parallel to the sternum. We see it passing along inferiorly, and as it crosses the costal margin, it becomes the superior epigastric artery. Internal mammary arteries may be used for coronary bypass. We've removed the chest plate now, and we can examine the contents of the thorax. For orientation, we show our cut across the manubrium here. Now, if we follow in the midline down, we can see where we've cut across, just superior to the xiphisternal junction. And going laterally, we can see our rib cuts that we've made along the costal margin, but 2 finger breadths superior. We now follow laterally. We see the ribs have been cut away in the posterior axillary line. We follow up to the axilla. We move medially, cutting the second and first rib. With the chest cavity itself is divided into a right and left pleural cavity and a central mediastinum. If we now examine the right lung, we can see we identify the apex of the lung, which extends up into the neck. We see the upper lobe of the lung here, divided from the middle lobe of the lung by the horizontal fissure, which we now indicate. The middle lobe of the lung is divided from the posterior lobe of the lung by the oblique fissure, which we indicate here. In the midline, we can see some of the heart. The heart is positioned slightly to the left. We can see if we follow the anterior border of the left lung down, we can see its cardiac notch here, which ends in the lingula. The lingula helps us to identify the oblique fissure, which divides the upper lobe from the lower lobe.